this is Anu and you are watching Anu for Nurses. Today let's discuss some simple but very important points of endocrine system. Use this opportunity to recall what's already learned by you. Always remember, many things we remember better by repeating it or getting exposed to the information multiple times. I suggest students preparing for exams must keep a notebook and pen so that if you find something very new information for you, please note it down. Thank you. Let's move on to the session. ADH and oxytocin is produced by hypothalamus and it's stored in posterior pituitary. The only endocrine gland that can store its hormones for a long period is thyroid. Remember, most other glands will be producing the hormones in response to the pituitary stimulating hormones, but thyroid can produce and store, and it will be released when the TSH stimulating the thyroid gland. The cells produce testosterone, Leydig cells. Glands that provides immunity in children and gets disintegrated in adulthood. Thymus. Milk producing hormone, prolactin, and milk ejection hormone, oxytocin. Know the difference: production, ejection. Placental hormones are all except HCG, HPL, estrogen, progesterone, LH, which is not a placental hormone. LH is not a placental hormone. Catecholamines are produced by the cells called chromaffin cells. Remember, all other cells too. GFR acronym in the previous video we have discussed. The glomerulosa, fasciculata and reticularis, then the chromaffin cells. Hormones that is opposite of parathormone. Parathormone is parathyroid hormone. Calcitonin. Kidney hormone vital for RBC production, erythropoietin. Angiotensinogen is produced by liver. Angiotensinogen is a protein that has a crucial role in RAS, and RAS video we have discussed it in detail. Renin is produced by JG cells of kidney, that is juxtaglomerular cells. ADH acts on which part of kidney? Collecting ducts. Master gland of body, pituitary. Remember, all the glands are controlled by hypothalamus, but the master gland is pituitary. Bat-shaped bone providing seat for pituitary, sphenoid. Seat of pituitary, that's a part of sphenoid bone called sella turcica or hypophyseal fossa. Hyposecretion of somatotropins in children. Somatotropins is also known as growth hormones. So hyposecretion in children result in dwarfism. Hypersecretion of growth hormone in children, gigantism. Hypersecretion of growth hormone in adults, acromegaly. Know the difference between the linear growth and the transverse growth. We have discussed this already in the previous video. The common drug used to suppress lactation, cabergoline. I know that you must be knowing cabergoline and bromocriptine, but cabergoline has less side effects and it's more effective than bromocriptine. When you have to choose among this, cabergoline has to be chosen, and in the clinical settings also, this is the one nowadays commonly used. Calcitonin is produced by thyroid gland, and the function of calcitonin is to maintain the mineralization of bones. So the blood level of calcium will be maintained by parathyroid hormone. This both will be acting in opposite to each other. Adrenal hypofunction leads to the condition Addison's disease. Hypofunction is Addison's. Hypersecretion of aldosterone leads to Conn's disease or primary hyperaldosteronism. Hypersecretion of cortisol leads to Cushing's disease. Truncal obesity, thin extremities and buffalo hump is typical feature of Cushing's disease. Hormone stimulates spermatogenesis, FSH. Hyposecretion of ADH leads to diabetes insipidus. Hypersecretion of ADH leads to SIADH. Water deprivation test is to diagnose diabetes insipidus. Metabolic derangement leading to diabetes insipidus. Hypokalemia and hypercalcemia. Remember, not just simple electrolyte imbalance like hypokalemia, hypercalcemia won't be leading to diabetes insipidus. It's all about long-term metabolic derangement. Drug that can lead to nephrogenic diabetes insipidus is, that's very important, lithium. Bacterial infection that can lead to addisonian crisis, Neisseria meningitis. Remember, in addisonian crisis we have discussed Waterhouse-Friderichsen syndrome, that's adrenal failure due to hemorrhage caused by bacterial infection called Neisseria meningitis. What's the priority management of addisonian crisis? Remember, first and foremost priority in addisonian crisis is IV hydrocortisone. Acid-base imbalance caused by Addison's disease. Metabolic acidosis. This is also discussed in Addison's disease. ACTH stimulation test to diagnose Addison's disease. Dexamethasone suppression test to diagnose Cushing's disease. Electrolyte imbalance associated with Addison's disease. Try to recall the electrolyte imbalance studied in Addison's disease. Hyponatremia, hypercalcemia and hyperkalemia. Brown skin pigmentation is seen in Addison's disease. Common carcinoma that can cause ADH hypersecretion. Small cell lung cancer is one major reason for SIADH. PPH causing pituitary ischemia. Sheehan's disease. Third eye of body. Pineal gland. Pineal gland secreting hormone melatonin. It's helping to maintain the circadian rhythm. Hormone of darkness is melatonin. The nerve that is associated with the production of melatonin, it's all about dark and light. So it is optic nerve. The first gland to develop in fetus. Thyroid. Hormone produced by kidney when in hypotension. Renin. Remember, RAS, renin, angiotensin, aldosterone system. Panhypopituitarism leads to a condition called, try to recall, yes, it's Simon's disease or pituitary cachexia. Fight or flight hormone is catecholamine. Hormone causing the release of ovum, LH. That's all for today. I hope it was helpful for you and we'll be back again with an interesting video. Till then, stay tuned and keep learning. Bye.